So you've done it. You've designed the process, you've battled through the PPQ batches, and that finally signed validation report. It feels like you've crossed the finish line, right? You can breathe. Well, today we're going to talk about why that finish line is actually the starting line for what might just be the most critical phase of all. Stage 3, continuous process verification.
We all know that feeling, don't we? That moment of pure relief when the final signature hits the page. The project's closed, maybe you even pop some champagne, and the team gets to move on to the next big thing. It's a massive accomplishment. But is the job truly done?
In the eyes of regulators like the FDA and the EMA, yeah, not even close. And, more importantly, for the long-term health and success of your product and your process, the real work is just getting started.
And this brings us right to our first big idea, what I like to call the one-and-done myth. It's this belief that process validation is just a project, something with a clear start and a hard stop. It's a really tempting way to think, but honestly, it's a dangerous one. You see, regulators don't see process validation as a project at all. They see it as a life cycle. It kicks off with stage 1, the process design. Then, of course, we move into stage 2, process qualification. That's where our PPQ batches live. But the key thing here is that it doesn't just stop. It flows right into stage 3, that ongoing continuous verification that makes sure your process stays in control for its entire commercial life. So let's dive into this continuous lifecycle reality. Let's really explore what stage 3 means and why it's not just about compliance. It's about becoming a true master of your own process.
So what exactly is continuous process verification, or CPV? Well, the official definition is right here. It's an ongoing program to collect and analyze process data. The two words to really focus on there are ongoing and analyze. This is not some report you write once that just gathers dust on a shelf. No, it's an active, living, breathing system.
And the phrase the regulators always come back to is this one: continual assurance. Think about that. It's not about a one-time proof. It's about building this body of evidence day after day, batch after batch, that proves your process is behaving exactly the way you designed it to. This analogy of a pilot in a cockpit, it's perfect. A pilot doesn't just get to 30,000 feet, hit autopilot, and then take a nap in the back, right? Of course not. They are constantly monitoring the gauges: altitude, fuel, engine performance, you name it. Your CPV program is your cockpit dashboard. It gives you the real-time data you need to fly that plane safely through the entire journey of commercial production. So why does all this matter so much? Well, it really comes down to 3 huge reasons. First, it's your early warning system. It helps you see a process that's slowly drifting towards a cliff before it actually falls off. Second, it deepens your process knowledge. It helps you understand things like how a new lot of raw material or even just a change in humidity might be affecting performance. And finally, let's be blunt, it's a non-negotiable regulatory requirement. Okay, so we get the what and the why. Now let's get practical. How do you actually build a CPV program that's robust and, actually works?
This playbook really has 4 key steps. First, you've got to identify what's important. You start with the stuff you already designated as critical: your critical process parameters, your CPPs, and your critical quality attributes, your CQAs. Step 2 is where the magic happens. You use Statistical Process Control, or SPC, with tools like control charts. Step 3, you need a smart data strategy. And finally, step 4, you put it all down in writing in a formal CPV plan. Now, that data strategy isn't static. It's not a one-size-fits-all thing. It really has 2 phases. Right after your validation, you're in what we call an enhanced monitoring period. You're collecting more data more often. You're watching it like a hawk. Then, once you've proven that the process is stable and predictable over time, you can transition to a more routine, long-term monitoring frequency. It's just a smart, risk-based way to do it. But here's the reality check. I don't care how well you design your process, eventually you are going to see a signal. That little red dot is going to pop up on your control chart. So what happens then?
And there it is, the moment of truth. You see an out-of-trend signal. Now, this is not a deviation. It's not necessarily a batch failure, but it is a clear, unmistakable sign that something has changed. The first rule here: don't panic. The second rule: have a plan. And that plan should have 3 simple steps. First, investigate the signal. Is this real process drift, or could it be something simple like an analytical error? Second, assess the risk. How big of a deal is this really? And third, and this is the step that so many people forget, you have to close the feedback loop.
When you're assessing that risk, you need to ask this really powerful question. Is this trend showing that my process is moving toward its edge of failure? Is your process capability, your CPK index, trending down? You see, this signal isn't just a single point in time, it's a vector. It's showing you the direction your process is heading, and your job is to act before it gets to that edge.
And that brings us right back to that feedback loop. This is the part that makes it a true life cycle. The data you gather in stage 3 isn't just for looking at, it's for learning. If you discover a flaw or an opportunity to make things better, that knowledge absolutely has to flow backwards to update your process design or your control strategy. This is what continuous improvement actually looks like in action.
So the crucial point in all of this is that stage 3 CPV is so much more than just a task. It really represents a fundamental shift in mindset, a shift away from reactive firefighting and towards proactive quality assurance. This slide just captures it perfectly, doesn't it? On the left, you've got reactive crisis management. That's where you're just running around, putting out fires after the dominoes have already started to fall. But on the right, you have proactive quality assurance. You're using your CPV data almost like a shield to see problems coming and stop them before they ever happen. It's the difference between being a lucky company and being a true quality-driven one.
And ultimately, this is why we do it. Diligent, data-driven, continuous process verification. It isn't just about making regulators happy. It's about the fundamental promise we make to ensure that every single patient gets a product that is safe and effective, not just for the first few batches, but for every single batch that follows. So as we wrap up here, I want to leave you with a question to take back to your own teams. What is the biggest challenge you face when it comes to implementing statistical process control? Is it the tools? Is it the training? Or is it the culture? Because answering that question, well, that's your first real step toward truly mastering your process in stage 3.